The Sefer Kohelet, Katuv Tovim Hashrayim Min Ha'echad. Two are better than one. On the programs you will see that we're hearing this morning about a very important topic, one which really touches all of our lives. As a school principal in the Chutz La'aretz, in Israel as well, I'm certainly familiar with the issues of autism and how it affects young children, and of course how it affects our society at large and how we deal with them. And the research going into trying to unlock the secret of autism and what causes it and how we can better deal with it is a desideratum of our modern era. Dr. Ruth Fischbach, who is a professor of bioethics and director and co-founder of the Center of Bioethics at Columbia University, who also is a second-time participant here at our conference, will be speaking to the ethics of the genetic research on autism. Dr. Fischbach's husband, Dr. Gerald Fischbach, who is the scientific director of the Simons Foundation, formerly dean of the medical school at the Columbia Medical College, and formerly director of the National Institute for Neurological Disorders and Strokes, a well-known scientist, has somehow agreed to team with his wife to form the dynamic duo and to discuss the neurological background for autism. For me, having attempted over a period of years to deal with a very, very difficult educational challenge, and that is dealing with autistic children within the mainstream classroom, which we tried to in our school, and of course dealing with them in the community, this is, I very much look forward to this session. Dr. Ruth and Dr. Gerald Fischbach, please come forward.
Well, good morning. This is the one. Good morning, everybody. I'm really happy to be a two-timer, and I'm happy to be here particularly today. Now, all the days of planning and reviewing the program didn't really prepare me for how informative and important this conference was to be. Having the panoply of these experts all assembled in one room, in one conference room and auditorium, sharing perspectives, I think is the epitome of what a good multidisciplinary conference should be. So thank you, John Loike, who is my right hand at the Center for Bioethics, the Director for Special Programs, and Rabbi Altshul, Bar-Ilan University, and the generous sponsors of this conference. It's been a great pleasure for me to listen to all the preceding presentations. I certainly have learned a great deal from them. And you may even find references to some of the things some of the presentations that we have heard in what I have to say. But my presentation will be a bit different from the others insofar as I'm going to concentrate on one specific collection of disorders, autism spectrum disorders, a grouping of pervasive developmental neuropsychiatric disorders. I plan to introduce the topic. Let's see. I plan to introduce the topic, provide you with a history and description of this complex and exceedingly challenging diagnosis, including some of the potential causes and their repercussions. Then, because my husband is here, and who I think graciously, I will say, agreed to speak with you, you will get to hear bonus to my talk. We heard he is the scientific director of the Simons Foundation, which is an organization dedicated to discovering the cause of autism. He's extremely knowledgeable about the genetics and the modes of genetic testing for autism spectrum disorders. Autism is generally accepted as the most genetic of all developmental neuropsychiatric syndromes. And while the nature of the disorders that fall under the umbrella of autism and how best to treat them continue to puzzle researchers, we are making progress, as Jerry will tell you about. And finally, I'll conclude with a presentation of some of the ethical, legal, and social implications that autism research presents. Much of what I say on the ethical, legal, and social implications of autism genetic research can be extrapolated generally to all genetic research into the many disorders which we have to face and challenge. Before I begin to discuss autism, though, I think it's imperative to consider some of the moral dilemmas raised in research and clinical care, thanks to our technological imperative. John Loicky presented to us a vision of future reproductive and stem cell technologies at lunch yesterday, which at the same time was amazing as well as frightening. The slippery slope never appeared more ominous, because in our culture, we are ruled by the technological imperative. This technological imperative states, if the technology exists, use it. But I believe we must follow the ethical imperative. So I want you to keep this in mind, not just today, but in the future. In research and medicine, your actions should be guided not by what you can do, but rather what you should do. This is the ethical imperative, and it's crucial for responsible research as well as clinical care. And so I also want to start with a principle that is obvious, but always, I think, needs to be said. And that is research, having the ability and indeed the opportunity to conduct research, is a great privilege. It is a sacred trust between you and the patients who will benefit from your efforts and ultimately the welfare of our society. Good ethics and good research go together. So to begin, Dr. Lewis Conner first formally described autism little more than half a century ago. An Austrian-born doctor, Dr. Conner, was working at the Johns Hopkins Hospital in Baltimore, Maryland in 1943. He observed a group of 11 children who seemed to share symptoms of a specific disorder. In Conner's seminal 1943 paper, Autistic Disturbances of Affective Contact, he described several years of pressure from Germany, and there were many supporters within Austria, both Nazis and non-Nazis. And it's been suggested that Dr. Asperger was one of those supporters. Jerry mentioned to me that among the 300 children that Asperger included in his seminal report, many were children of Nazi officials. Despite Conner and Asperger's publishing their papers in such a close time frame, in fact, they worked completely independently and never spoke to each other for more than 30 years. Over time, doctors studying individuals diagnosed with Conner's autism or Asperger's syndrome noticed that these two disorders were not completely separate. Instead, individuals with either one of the disorders often had overlapping symptoms that seemed present in what can be described as a continuum from severely affected and low functioning with a diagnosis of autistic disorder to mildly affected and high functioning who fell under Asperger's label. So what are the disorders that have been classified as autism spectrum disorders? I emphasize today that the picture that you see on the screen, this Diagnostic Schedule Manual, 4th edition, this, or some people call it the DSM-4, the Bible. These disorders exist under the general umbrella term of pervasive developmental disorders. These are a group of disorders that affect an individual's development in several areas, such as speech and social skills. These disorders are usually evident within the first few years of life and are sometimes accompanied by mental retardation or epilepsy. Rett syndrome, which Jerry will tell you more about, is a serious, complex disorder of the nervous system that's characterized by the loss of ability to move the hands with a purpose, but often is seen with kind of a hand-wringing behavior pattern. Strangely, it's found only in girls and is thought to be caused by a specific genetic mutation which has recently been identified. Childhood disintegrative disorder is characterized by a period of normal development for the first 2 or 3 years. By the age of 10, however, an individual with CDD loses cognitive, motor, language, or social skills. Individuals with autistic disorder, who we often think of as the classic autism, show abnormal or impaired developmental manifestations before the age of 3. They have abnormal functioning and reciprocal social interaction and communication, accompanied by restricted, repetitive, stereotyped behavior and interests. The main difference between autistic disorder and Asperger's is that Asperger's individuals do not show delays in language or cognitive development. In fact, some Asperger's individuals have higher than normal IQs and excel in one specific area. They're often described as savants. And just remember the movie Rain Man. The biggest problem for individuals with Asperger's tends to be the difficulty in social situations because they don't understand body language and other nonverbal indicators. PPD-NOS is a sort of catch-all diagnosis for an individual who displays some but not all of the characteristics of ASD, and for some reason does not exactly fit into the diagnosis. So the DSM-4 right now is being revised, with the new edition, DSM-5, being scheduled to be released in 2013. In the proposed DSM-5, which has become extremely contentious, the diagnosis of Asperger's will no longer exist, and the concept of a spectrum will be emphasized. The Asperger's community is distressed at losing what they consider an elite status, calling Mozart, Einstein, and other notables members of their community. Now, what do we know about the cause or the causes of autism? Throughout autism's history, many different theories have been proposed to explain the cause of this disorder. Connor believed that autism was mostly caused by genetics, but thought that cold or uncaring mothers might have also contributed to a child's development of autism. As early as his 1943 paper, Connor was calling attention to what he saw as a lack of parental warmth and attachment to their autistic children. And in a 1960 Time magazine interview, he described the mothers of autistic children as, quote, just happening to defrost enough to produce a child, unquote. It didn't take long for child psychologist Bruno Bettelheim to coin the term refrigerator mothers. His articles, primarily in the 1950s and 1960s, popularized the idea that autism was caused by maternal coldness to their children. In retrospect, it would appear that both Connor and Bettelheim were confusing cause and effect, much like we heard in Eric Schoen's important comments yesterday. It's more likely that any lack of attachment they saw between the parents and their autistic children was due to the lack of social reciprocity in the children, and they consistently ignored the fact that the affected children had unaffected siblings who were presumably exposed to the same parents and their warmth or lack of it. As you can imagine, this labeling led to an enormous burden for parents, especially mothers of autistic children, because it seemed to blame them for their child's disorder. Fortunately, in the early 1970s, this theory had largely fallen out of favor. Although a few people and even a few medical professionals still blame autism on maternal lack of affection, the growing volume of data supporting a biological cause clearly refutes this. However, other potentially dangerous blame the parent notions have arisen. According to these, parents are responsible for their children's autism in two ways. First, allowing autism to persist by not administering all of the therapies recommended by a burgeoning number of so-called experts and healers. This is evidenced by repeated references to the window of opportunity in treating autism. And second, most pervasive, causing autism through ignorance or willfully disregarding warnings. by allowing their child to receive routine vaccinations with products that contain thiomersal, a mercury-containing preservative, or a combination of the measles, mumps, and rubella vaccines. So how did all this happen? In 1998, Dr. Andrew Wakefield, a British physician, published an article in The Lancet, a renowned British medical journal. His article pointed to the measles, mumps, and rubella vaccine as the cause of autism. The article received widespread attention and led to a dramatic decrease in the MMR vaccinations given to children, along with an increase of measles cases. The theory fit exceptionally well with what parents were experiencing. Their children were normal, healthy, loquacious, and physically fit. Somewhere around their second birthday, they received their MMR vaccination, and within days, their children seemed to deteriorate right before their eyes. They lost the ability to speak, relate to their parents, and became perfectly oblivious to everything around them. The media sensationalized this report, and Wakefield was hailed as a hero. The temporal connection was so strong that strident proponents like Jenny McCarthy and Jim Carrey refused to concede that the vaccine was not responsible even after thiomersal was removed from the vaccine, and numerous epidemiologic studies did not support this theory. And there were serious repercussions. According to a February 2009 article that reporter Robin Deere published in the Sunday Times of London, Wakefield managed to drive MMR vaccination rates in the UK below the level of herd immunity, from 93% to 75%, and as low as 50% in some parts of London. Amazing. Deere reported that there were only 56 confirmed cases of measles in England and Wales in 1998. In 2008, 10 years later, after this Wakefield report, there were 1,348 confirmed cases of measles. Well, as we now know, Wakefield's data were unfounded. He claimed to have linked the MMR vaccine to regressive autism and inflammation of the colon. A study followed up 4 years later with a paper that claimed to have found polymerase, can't say that, Jerry? Polymerase chain reaction, PCR, the strain of attenuated measles virus used in the vaccine in the colons of autistic children. Brian Deere reported ultimately a report that totally blew the whistle on Wakefield. First, it was reported that Wakefield had been paid huge sums of money by lawyers who wanted to sue vaccine manufacturers for vaccine injury, a conflict of interest he had never revealed. Also, months before he published his Lancet paper, he had applied for a patent on an allegedly safer single measles vaccine that could succeed best if the safety of the MMR vaccine was called into doubt. The story has not ended. Despite the Lancet retracting the paper, and on May 24, 2010, the United Kingdom's General Medical Council Tribunal ordered that Wakefield and one of his 12 co-authors be erased from the medical register, revoking their medical licenses. But Wakefield, who now resides in Texas, and his ardent followers claim that all of this is just a great conspiracy, so the sordid saga will continue. Because autism is felt to be a complex disorder, other potential causes, such as parental age and environmental triggers, are now being considered as causes. So let me turn the podium over to Jerry, who will provide the overview of genetics and genetics research.